Hi, my name is Kim Gould. I'm a family health nurse practitioner and a doctoral student at Arizona State University. Thank you for taking time to participate in this study. For the next 10 minutes, I will talk about the human papillomavirus, also called HPV. I'll discuss how you become infected with HPV, the consequences of infection, and how you can minimize your risk. So let's begin. Human papillomavirus is the name of a group of viruses that can infect the skin, causing warts on the hands and feet. We call these common warts. And the mucous membranes, causing lesions on the lining of the mouth, the vagina, anus, penis, and the cervix. There are many types of HPV, actually more than 100, and about 30 types can infect the mucous membranes of the genital areas. These HPV types are referred to as either high risk or low risk. High-risk types can cause abnormalities to develop in the lining of the cervix and can sometimes turn into cancer. Low-risk types can cause genital warts and abnormal but non-cancerous changes in the cervix. So how does someone become infected with HPV? We'll talk about that next. Generally, anyone who engages in any kind of sexual activity involving genital contact with an infected person can get HPV. It is the most common sexually transmitted infection in the United States. The Centers for Disease Control estimates that there are more than 6 million new HPV infections every year in the U.S., and that 3 out of 4 infections will occur in men and women between the ages of 15 and 24. Most women will get HPV during the first 2 years of becoming sexually active. They are at risk of acquiring an HPV infection from as few as one sex partner, so risky sexual behavior is not necessary. And you do not have to have intercourse. Transmission can occur through oral genital, hand genital, and genital-to-genital contact. So if you do get infected with this common virus, what are the possible consequences? It is important to remember that most people with HPV do not develop symptoms or health problems, and approximately 90% of the time, your body's immune system will clear the HPV infection naturally within 2 years. Unfortunately, we cannot know who will clear the infection and who will not. What we do know about HPV is that each year 12,000 women will get cervical cancer and 4,000 women will die from cervical cancer. An additional 4,700 women will get vulvar and vaginal cancers, and there will be 500,000 new cases of genital warts. And in the next few slides, we'll talk about the effect of HPV on the female reproductive system. The female reproductive organs consist of the uterus, cervix, fallopian tubes, and ovaries. Cells in the lining of the cervix, the vagina, and the external genital areas can become infected with HPV. Low-risk types of HPV cause mild changes and may produce no symptoms, may cause genital warts, or may clear on their own. High-risk types may not go away on their own, and persistent infection with high-risk HPV can lead to changes that may progress into cervical cancer. In fact, most cervical cancer cases are caused by persistent infection with high-risk HPV, so it is very important to detect changes in the cervical cells early. Abnormal cervical cells are detected using a Pap test. A Pap test involves taking a small sample of cells from the cervix. These cells are then sent to a laboratory where they are prepared and evaluated under a microscope. If a Pap test detects abnormal cells, your healthcare provider may choose watchful waiting. Since most infections will clear within 2 years, watchful waiting is the most common approach in young women. He or she may choose to repeat the Pap test, usually in 6 months, or perform other tests, including HPV DNA testing, which can determine if you have high-risk HPV, or perform a colposcopy and obtain a biopsy. Sometimes abnormal cells have to be treated. We're not going to talk about those procedures today, but if you have any questions, please ask me at the completion of the program. Now let's talk about cervical cancer for a minute. As I mentioned earlier, nearly all cervical cancer is caused by persistent infection with high-risk HPV. Changes in the cervix are usually discovered early through Pap tests and can be treated very successfully before the cells become cancerous. But if not discovered early, some abnormal cells can become precancers and then cancer. Cervical cancer progresses slowly, and about half of all women diagnosed are between the ages of 35 and 55. What many of these women may not realize is that they were most likely exposed to one of the high-risk types of HPV during their teens or 20s. It is important to note that most women who are diagnosed with cervical cancer today have not had a Pap test for many years. Genital warts are much more common than cervical cancer and are caused by low-risk HPV types, which are different from high-risk types that cause cervical cancer. Although these lesions are abnormal, they are not cancerous. After sexual contact with an infected person, genital warts may appear within weeks or months. The lesions are usually flesh-colored and can be flat or raised, large or small, or the infection can be there and you can have no lesions. In these remaining slides, we'll discuss how you can minimize your risk of HPV infection. The most important thing you can do is to get regular screening with a Pap test, beginning at age 21 or within 3 years of becoming sexually active. There are also other behaviors you can adopt that will decrease your risk of HPV infection. First of all, don't smoke. Studies show smokers have a higher incidence of cervical cancer. Second, you can limit your number of sex partners. Women who have more sex partners are at risk for repeated and persistent HPV infection. You should always use condoms. Condoms cannot prevent HPV infection, but consistent 100% use with every sex act from start to finish can decrease your risk. You can delay first intercourse. Women who have sex at an early age have a higher risk of HPV infection. And finally, you can get the HPV vaccine. Remember I said that high-risk types of HPV cause almost all cases of cervical cancer? Well, there are many types of high-risk HPV, but it appears that 2 types cause over 70% of cervical cancer, and 70% of genital warts are caused by 2 types of low-risk HPV. The HPV vaccine Gardasil provides protection against these 4 types, and the vaccine Cervarix provides protection against the 2 high-risk types. The vaccine Gardasil is approved for boys and girls between the ages of 9 and 26. It is usually given around the age of 12. Even if you are already sexually active and may have already been exposed to HPV, the vaccine still offers protection against HPV types you may not have been exposed to. The vaccine is given in a series of 3 injections spread over a 6-month period. You should not get the vaccine if you had an allergic reaction to a vaccine, or have an allergy to yeast, or if you are pregnant. The most common side effects are redness and mild pain at the injection site. Fainting has also been reported, and for that reason, you will be observed for 10 minutes after the first vaccination is given. So let's review. Remember, HPV is very common in males and females, and most people with HPV infection do not have symptoms and will clear the infection naturally within 2 years. So it is important to keep your immune system healthy and see a healthcare provider if you have any lesions in the genital area. And finally, receiving the HPV vaccine is important, but does not take the place of regular screening with a Pap test. For more information about the HPV vaccine, talk to your healthcare provider. Additional information is also available on the websites for the Food and Drug Administration and the Centers for Disease Control and Prevention. Thank you so much for your participation. Have a wonderful day.